Welcome everyone to our panel tonight where we're talking about non-traditional placements, fieldwork placements in non-traditional times. But I think this is pretty awesome in a way that even once we're done with COVID, hopefully some of these neat fieldworks that are being done will continue because I think there's a lot of value out there in doing this. So for those of you that have just popped on in the chat section, if you could just let us know if you're OT, OTA, a student, and also another thing that would be awesome, let us know if you are in need of a field work or if you're one of the students that haven't been able to get a placement out there, just so we kind of know who's all on, and make sure you're replying to everyone, all panelists and attendees. So this is kind of what the process will be. So we'll all just introduce ourselves and give a brief background about us, and then we're going to break in to the different groups that are on here and speaking together. And Sophie and Morgan and I and probably Jeannie will probably go first because Sophie has to get to work, and then we'll go to all the other groups. So we'll get started. So I'll introduce myself first. So my name is Kara Welke. I'm an occupational therapist. I've been an occupational therapist for over 20 years. I have my own therapy business called Home Therapy Solutions, where I see older adults in the home, primarily a mobile Medicare Part B practice. We do have or have had some private pay out-of-network clients as well. I'm also the creator of Next Level Occupational Therapy, and that's a platform to help occupational therapy professionals in general to level up in your career or life. We do a lot of fun different things within that. So if you haven't checked out that Facebook group, it's a free group. At least jump on and check it out. I have also been an occupational therapy assistant fieldwork director. I was one for 8 years. Last December was when I left that position. And just a little side, so I'm very passionate about fieldwork and fieldwork placements. And a few years ago, it was when we had the National AOTA conference in Salt Lake City. It was like the March before that conference. I had a lot of fieldwork students just really frustrated when they were out on their level 1 placements, their 1 week placements, because they were like, nothing is being done how you teach us in school. You know, everything is UBE, TheraBand, not functional, not occupation-based. They were, complaining about how, some therapists were billing, even though they were just sitting there and not doing anything with the client, but they were using documentation time, things like that. So that March through April, and that's how I first met Jeannie, actually. But that March through April, I was so frustrated reading all those comments. I put out a call to the academic fieldwork listserv, and I was like, we need to start something. So we started an occupation-based, client-centered, evidence-based practice task force. And we met in Salt Lake City, and we got a few things going. But yeah, then I ended up leaving, and I don't know where anything is at with that. So I'm super excited about, I was able to work with Jeannie, and we were able to take Sophie as a totally virtual fieldwork student in my mobile Part B practice. And she was definitely a guinea pig, but she was the perfect guinea pig for my placement because she did really well in this super non-traditional placement, but we'll get into that a little bit. But that's kind of the background. So very passionate about OT students and good fieldwork placement. So I'll kind of just go around the circle. Claire, do you want to go next and give us a little background about you?
Sure. I'm Claire Lynch, and I live in Houston, Texas, and I've been an OT for over 25 years. And I currently work as a lab skills instructor for an online OTA program at St. Catherine University. And I also work outpatient at an independent living facility, but I haven't done much of that since March. But anyway, so I just finished having my student, Samantha, she's on the panel also. And so we had we were totally virtual because she's in California and I'm in Houston. So, so that's where we are.
Let's go to Samantha next. And then once we get around to everyone, then you two can kind of talk at the same, together. So Samantha, you want to introduce yourself?
Hi, my name's Samantha. As Claire said, I just finished up my level 2 fieldwork with Claire. I'm in Los Angeles, California. I had done my first 8-week placement back in January and February, and then I'd started my second placement. It was 4 weeks in March when COVID hit and I had to leave. It was at a skilled nursing facility. My first one was in pediatrics, but luckily I was able to finish my last 4 weeks via telehealth at a non-traditional placement with Claire. So now I'm officially finished. And yeah.
Awesome. Thank you. I'm excited to hear more. Let's go with Felicia.
Hi, everyone. I've been in pediatric OT for 13 years. I've worked in pretty much every area of pediatrics. But for the last 7 years, I've worked in higher ed. So I've worked with an OTA program in Connecticut, as well as right now, my current position is with an OT program in Massachusetts. So I run a pediatric community-based clinic, which is primarily run by OT students. And we do it through a collaborative approach. So we have a group of OT students that will provide the services to the children that we're servicing, and they have one supervisor. I work with Lexi, and she's in mental health. So we actually have 4 different community-based practices within our university.
And Felicia, how many do you have at a time, students?
Currently, I have 4 students, but the max I've had is 8, but we try to keep it around 6.
I mean, you are totally a rock star. I mean, I love this. And she was a huge help for me because she had a lot of resources that I was able to utilize, because this was the first time I've taken students in my own practice at home therapy solutions. So thank you, Felicia, for helping me with a variety of different things. So awesome. Well, let's go to Lexi then.
Hi, everyone. I'm Lexi. I've been an occupational therapist for 3 years, practicing in community-based mental health, and currently I'm a clinical instructor at the same mental health sites. I'm currently part-time, so I actually just have 2 students, but then we'll have 3 students in January. So we're doing a little bit of both. So I'm on site and then also doing telehealth.
Fabulous. Thank you. Okay, let's go to Erin.
Hi, everyone. I'm Erin. I have 2 weeks left of my 2B fieldwork right now in a school-based setting, but I completed my 2A fieldwork completely virtually with a population health focus, and Sarah Anderson was my supervisor.
Sarah, do you want to go next?
Sure. So hi, everybody. My name is Sarah Anderson, and I teach full-time at Midwestern University. My clinical areas of specialty are mental health and pediatric mental health, specifically in areas of anxiety and trauma. And I'm extremely passionate about role emerging fieldwork. I'm actually an assistant fieldwork coordinator focused on role emerging and non-traditional placements at the university where I teach. And I have a podcast called The Innovative OT that is dedicated to non-traditional practice for both OTs and OTAs. So we actually just finished up another semi non-traditional placement for some of our level 2 OTs. Their last level 1 got canceled. So we did more of a group-based field work at a modern aging facility. And we really focused on incorporating the OT process and theories and talking about therapeutic modes. And it was really successful. So we're really trying to push more non-traditional role emerging placements where I work, which is fabulous.
Love that.
Someone said, can I repeat the name of the podcast? The Innovative OT. It's on all major platforms, so you should be able to find it.
Awesome. Okay, super excited to learn more. Okay, Jeannie, you want to go next?
Sure. Hi, everybody. I'm Jeannie. I'm from Cleveland University in Kansas City. Well, technically we're located in Overland Park, but Kansas City metropolitan area. Sophie is one of our students that did her field work with Kara, just finished her second level 2 field work. One of the reasons that Kara invited me today is that our group of students that we had that were supposed to finish in the spring, like Samantha's story, you know, they were halfway through their second level 2 and it was canceled. And we were really trying to figure out what could we do. And we have a community-based site here in the Kansas City area that we use for level 1 and level 2 field work. And our faculty is the fieldwork educator for it, but they were closed because of COVID. And we were trying to figure out how could we do something with telehealth? And we didn't know if people there had enough resources for that. And then I thought, I have a friend who is a nun, a religious order, and their community is very tech savvy with Zoom, because that's how they do all their meetings now. And so I reached out to them and we created a level 2 virtual telehealth experience for 15 members of this religious community, both vowed members and they have non-vowed members. So you don't necessarily have to be Catholic to be in this group. And it was a learning experience for all of us, but it was really, really fun. So our program director was the OT who did the evaluations. I don't know if I said, I am an occupational therapy assistant myself. I've been one for over 23 years, and I've been a fieldwork coordinator for the last 5 years. So we put it together in like 2 weeks, and our students were able to finish to graduate and only be a semester behind. So
that's fabulous.
Field work again for part of Sophie's cohort, then did it again in the summer and fall. So we're hoping we can continue it somehow. So,
and we used, you know, a little bit of that model with Sophie and Morgan with our members, and Jeannie was nice enough again to help me with some forms and paperwork and stuff for clients. So, and that's why, you know, pulling all of us together and sharing these resources so we can help more and more students is huge. So Sophie, why don't you go next?
Hi, I'm Sophie Yancey, and I basically just finished up my occupational therapy assistance degree with Kara and Jeannie as my fieldwork coordinator. And yeah, it was a fun experience. Very different, but I think it was challenging in all the right ways of making sure you learned everything that you learned in your classes. So
awesome. And we'll get more into detail in a moment here. So how about Morgan? You want to go next?
Sure. Hi guys, I'm Morgan. I recently just finished along with Sophie last Friday with Kara. And before that, I completed my first level 2 fieldwork placement at UAB Spain Rehab Center down in Birmingham, Alabama. And then actually in the middle of that, Kara contacted me and said like, hey, where are you going to be for your next level 2 fieldwork? And I was supposed to be at a school, but they were uncertain about, you know, opening schools with COVID and everything. So I was like, and then Kara offered me a spot to be a student with her, and I was like, well, I'm just gonna jump on that, because Kara was actually my teacher back before she resigned in December, and I really enjoyed her as my teacher. So yeah, it's a good experience.
Awesome. And we'll jump into more. And Heather, you're next.
I'm gonna unmute myself here. Hi, my name is Heather Haight, and I am a CODA as well as an occupational therapy student from Concordia University of Wisconsin. And I am very blessed to have Kara as my CI for this last field work before I graduate. So I've been on hold for quite a while. And I contacted Kara, and I was actually very interested in what she had to offer as far as starting my own mobile Part B practice. And so the conversation led to a fieldwork placement, and I am just thrilled about it. And I've got about a little over 6 weeks left to go. So it's been amazing.
Time goes by way too fast.
Doesn't it? Yes, it really does.
I keep thinking of all the things we were still gonna do. Oh well.
No. Yeah, we'll get to it. It'll happen.
Yeah. Okay, and Lisa.
Well, I am here really to promote that anybody who has a non-traditional site, who is an OT, to really welcome students right now. It is desperately needed. My non-traditional site is a nature-based setting. My business is here in Wisconsin. And in the last 6 months, partially due to COVID, I've had 1 OT student, level 2, 2 OTA students, level 2, and 7 level 1 OTA students, all in the last 6 months. So I love it. I think it's great fun for you to share what you know, but you also learn from them, and just really draw those connections between your non-traditional site and OT. And if you can draw those connections and have those aha moments with them, it's just awesome. So I'm here to promote it for all of those OTs out there who have a non-traditional site or location, that it can be done. It's not scary to welcome students, and it's desperately needed. So if you're on the fence there, I would say go for it. I have another OT coming up in this winter session, and then 2 more OTs in the spring. So it's busy, but it's wonderful to provide that opportunity and to learn with them. So I enjoy it, and I encourage all OTs to do the same. So that's my spiel.
And kind of a funny story. So Morgan, actually, when I was still teaching, she was doing her CAT, her critical appraisal of topics, if I remember even what that is, right, Morgan? But I had connected Morgan and Lisa together, and we had even talked about it would be an awesome fieldwork placement to go, but you already had students picked out. So kind of a small world, but that's pretty cool that we're all on.
Mm-hmm. And all of my students have been from St. Kate's in Minnesota. So someone had said St. Kate's. So yeah, I'm just right across the river. So
awesome. And Lisa, Caitlin wants to know, what is a nature-based setting?
Mm-hmm. Well, it's really where we provide services outdoors in nature. So a lot of that happens in the summertime. I do groups, and then I do private therapy. So my groups are just more of a nature-based opportunity facilitated by professionals. I do have support from speech and language pathologists also. And so I do groups more geared towards children with and without unique needs, and all have different themes, from mental health to play-based in nature fun. And then the private therapy is doing the evaluation, setting goals, and all of that. Yeah, it is cool.
And you have animals. What all animals do you have now?
I have 2 sheep, 2 mini donkeys, a horse, and a dog. And we're not getting any more anytime soon.
Yes, make sure you check out Lisa's website, and she has a Facebook group, and she does like groups specifically for, you have some groups specifically for girls. She's big into holistic health, mindfulness, all that kind of stuff. So what's your Facebook group, Lisa?
Nature-based occupational therapy and related professions group. I'll put it down here.
Awesome. Okay, well, let's get started. So Sophie and Morgan, let's start with you two, since I know Sophie has to get going. So little bit of background about my practice, and then I'll let Sophie and Morgan just kind of talk about their experience back and forth. And then you guys in the chat, ask away questions for them. But so I have a very chaotic life, as Sophie and Morgan do know now. So probably not the best fieldwork educator in the world. And I was very blessed because both of the students did very well in my chaotic life and world. But I think it worked very well having both of them at the same time. So Morgan was with me and went to all of our clients together. And then Sophie was with us virtually. So we took my phone and we Zoomed Sophie into all of our sessions, and Morgan was there. And yeah, I mean, like I say, I'm kind of here, I'm scare them when I have so many things going on. And we ran into things like running out of battery or things like that as we went. And I was a little unsure, like if the clients, how they would do, but they loved it. And this week has been hard because they all missed both of them. But yeah, so it would be me, and Morgan in person with the clients, and Sophie through my phone on Zoom for all of our sessions that we went. And those were kind of sporadic through the week. And then Sophie and Morgan each had their own clients that they did telehealth sessions with twice a week. And then they both did a group exercise session once a week. I know when I start talking about this, Morgan and Sophie, I'm like, you guys did a lot. And then they both did a caregiver support group once a week. So they got individual time, they had their own clients, then an exercise group and a support group. The exercise group and support group were all online. And then on top of that, since I help business or OTs and PTs and other therapists start their own business, they also did a lot of social media creation. They wrote a lot of blogs. They did a lot of Facebook posts, content creation. They managed a Facebook group for older adults. I know you did more, tons of stuff. And they were able to come to some of our meetings with therapists building their businesses and so forth. So which one of you want to go first? You guys can kind of go back and forth, talk a little bit about the experience.
Oh, there's my dog. Well, yeah, we can both kind of go back and forth. I don't know if I would have actually survived without Morgan, though, to be honest. We definitely were a good team working together. I remember the first day calling her and I was like, all right, let's divvy, conquer, and divide kind of situation. And it was just kind of nice to have that team player. We ran a support group on Friday mornings, and then we did the exercise group on Wednesday mornings, and we split that in half. So she would do the first half and I would do the last half. We took turns every other week-ish for the leading the group, which ended up being a whole lot more fun than I don't know. I just didn't get a whole lot of group experience, so that was a lot more practice for me. I don't know. What about you, Morgan?
Well, actually, when I first heard that there was going to be another student, I was like, what? I was like, I didn't know how I was going to handle that, just because I like to do things on my own. But then, yeah, as soon as I called Sophie that first time, I was like, I think we're the same person. I think we're going to get along really well. And yeah, I don't think I would have survived without Sophie either. Like, she was such a big help to me. And I think we were both very overwhelmed at the beginning because we're just seeing all this stuff we had to do and it was all new to us. But it's like with anything, once you get into it, I mean, you get into the hang of things and it gets easier. So it got easier over time, but yeah, we did a lot, but I think we did well.
The other thing I'll just add for therapists that are watching, I mean, Sophie and Morgan did so much to help me too. I mean, just the content writing and all of that, but the note writing and all of that was a huge help. And they were able to write notes and and I was able to utilize them to help me in my practice. But the other thing is, so oftentimes when we're done seeing clients, they could still benefit, right, for some other therapy, but they don't necessarily want to pay private pay, or they might not have the funds or things like that. So the clients that they each worked with, so they each had 2 clients that they worked with twice a week. And those clients were ones that were already on caseload at one time with me, or they were still on, but they would benefit from some extra therapy. So it was just great for my clients to have additional therapy above and beyond what they could get. Can you guys talk a little? And they were kind of tough though, like Morgan and I specifically talked about a couple of her clients, because they had met a lot of their main therapy goals when we started. So it was more of like a maintenance approach, or a little different take on the therapy side of things. But could you guys talk a little bit about your one-on-one sessions with your clients?
Let's see. I think, yeah, like I've always struggled with coming up with treatment ideas in general, and then to be seeing 2 clients that Kira's already seen for a while, and she's tried this, she's tried that, I'm like, well, now I don't really know what to do. But I think so that was the hardest part for me. But I mean, overall, I think it went well. And like, one of my clients had dementia, and the other had a number of different things going on, like depression, lymphedema, arthritis, like a lot of hip replacement, or like a lot of joint replacements. But I mean, I think it went well. What do you think, Sophie?
I feel like it was pretty successful. A lot of it seemed like it was a lot of education based. So some of it they might have had already known, but we also tried to educate them on what our role and how we can help them with said diagnoses that they had, and maybe finding other and new ways to manage it. And Morgan and I bounced ideas off from each other. We'd meet, or at least do like an email chain or a text chain daily, if not weekly. We'd bounce ideas off of Kara, and then Heather had also came in within the last 2 or 3 weeks before we had finished. So it was very collaborative, and
Yeah, we would jump on the phone and have in between clients, we would have jump on the phone and get all 3 of us on there and kind of talk about how the session went. What did you guys think, or plan? What should we do in this session? And they got to experience, clients in person, and also the virtual health kind of side of things, and do different assessments. So we have to think a little bit there, especially for Sophie, what kind of assessments could they do? So Sophie, one thing that was something we had to think of was, how could she, because we still want them to meet all the skills on the fieldwork evaluation form. And so she did, Morgan did too, but they both did videos, training videos on different techniques. So then I could see, do they have the skills in safe transfers or different OT related techniques? And it kind of served double purpose. One, they posted them in our Facebook group that's specifically for older adults, so they could learn the safe way to get into the car, or the safe way to do bed transfer, things like that. So it helps older adults, but then it also allowed them to demonstrate their skills with that. They also did 2 community presentations each. And they did them live in our Facebook group as well. And they picked different topics that would help older adults with that. So yeah, I mean, they did a ton, and that's kind of how my life is. I put too much in, and then I realized we have to taper down a little bit. So they were the guinea pigs for it. They also, I mean, they helped develop the fieldwork manual. So they took what Felicia had given us and helped modify it for my program. They did a ton. So if you are worried about taking a student for the first time, don't be, because your students can help you create a lot of that stuff too. And we can definitely share, you know, they had a hour tracker where they kind of wrote everything they did. Every week we would go through their task list of what they were supposed to do that week. You know, some weeks got a little crazy and we'd do it the next week, but they were very flexible. So yeah, let's let Heather join the mix, because
Hey, Kara, there was a question, Kara, about the name of the Facebook group where the videos are posted.
It is Aging with Purpose in North Dakota and beyond. And I'll put the link down there. But it kind of worked out that Heather was able to come in as an OT student, and then she was able to work with both Sophie and Morgan and do, you know, some co-treats and provide information on writing the notes. So it, you know, they were able to get that OT-OTR relationship, plus Heather was able to do some supervision. So I thought that was kind of cool. So Heather, you want to kind of go in on your involvement?
Sure. I was really excited to be able to have that role in a supervision situation, and also be able to transition the patients that Sophie and Morgan were working with, being on those conference, you know, therapy sessions. And then it eased that transition when Sophie and Morgan, you know, were done. And then I came in and worked with them, so they had a familiar face. And of course, with patients with dementia, it's nice to have that consistency. So I've just loved that, and I've loved to be able to translate that consistency into my treatments that I've been working with in a virtual format. I mean, this is just so non-traditional, but it's wonderful. I think it's going to be more of a trend. I do believe that this is a needed way for people to get their therapy with a virtual format. So it's just been a great learning experience so far. I've also been able to start working on my Part B practice, and that's been really wonderful. I just did a course on dementia, an all-day seminar for that. So being able to incorporate that into the whole game plan has just been just so wonderful. And it's just so happy to be able to do it.
Yeah, and for those of you guys, so Heather is able to kind of multi-purpose her field work. So we worked with her school in that, so she's in our therapy business builder program, where we help therapists across the United States start and build their own therapy business. So she was able to do that program along with some of the other stuff, like seeing the clients virtually, managing social media, and she's able to do that all for her level 2. So it served two purposes. One, she's finishing her level 2 so she can graduate, and 2, she's starting her own business right now as a student. So I think that is so awesome, and something that people should really look at if they're interested in that. So awesome.
Yes, for sure. I'm so thrilled about it. This has been a dream of mine for so long. You know, working with older adults for 20 plus years. So this has been a long time coming, and it's just, it all fell into place. Who knew?
Awesome.
Wonderful.
And Morgan, I just want to put you on the spot a little bit. So just because you mentioned this to me when you were out on field work, but can you just talk about the difference of working with clients like in a rehab center versus working with clients in their own home?
Yeah, I definitely found out I don't like working in inpatient rehab. I remember when I was at UAB, not that it was a bad place, it was just that it was every day that we would put the clients on a UBE bike or have them use the ladder board or free weights. And like, I think it was like the second week that I was there, I wrote on a sticky note, I was like, occupational therapists are not personal trainers. And I put it on my clipboard that I brought with me every day to the rehab place, because that's what I felt like 90% of the time. I was like, we're just handing these people free weights and we're calling that occupational therapy. And then so with Kara, I mean, I think she definitely helped me discover like my true passion, where you can see clients in the home, you can use everything in their home as therapy. And like, I was like, okay, this is true OT. Because when I was at UAB, I was like, is this what it's going to be like when I'm on the job? I didn't know. But so, yeah, I mean, I've heard Kara say before that she doesn't think she's a godsend, but I mean, for me, I think she was a godsend. So, yeah.
Well, thank you very much. But I just wanted her to tell you guys that because, I mean, all of us in the home, if we can take more students in the home and those of us that have these occupation-based client-centered treatment, that's going to help all of these students get these placements because guess what? I mean, we don't know what's going to happen yet, but I was able to connect Morgan with 3 different therapists, and one therapist is actually kind of doing a practice like mine, and we're hoping that maybe Morgan can work with him and do this mobile part B because, I mean, she knows what she's doing. It'd be a great placement. The whole OTA position with that is a little bit difficult, but just if we can get more and more students learning about this would be awesome. And Sophie, I'm going to put you on the spot one last time because you experienced everything virtually. And we talked about how it's definitely different virtually. Can you just talk a little bit about that?
Yeah, because I mean, you're limited in intervention wise what you can do. So a lot of it you kind of almost have to take a little more of the like I said earlier, like education based, but also kind of like the mental health based and making sure besides just their physical health, like their mental health. And even with like the caregiver support, like I did a presentation on caregiver burnout because who's going to take care of the person if they're experiencing the burnout and not taking care of themselves. So I remember like the theme of the last couple of weeks when I was creating that presentation was, you know, who do you put the mask on first in the airplane? You put it on yourself, then you take care of the kid next to you or your loved one next to you. So it's just kind of one of those things, is just making sure that no, you're not physically there in person with them, but there are still items to be able to be addressed, such as the education part, like by conversation, by using the occupational profile and like the COPM, and really just digging for that information, having to ask a lot of questions and a lot of interview based assessments and stuff like that.
Yeah, I mean, they did really good because I'm not a telehealth virtual therapist. So we, you know, I mean, they did really good adapting and finding neat and different things to do. And it was a struggle at first, but I mean, they really adapted and did well. So, okay, we better move on to everyone else. So thank you guys. I know, Sophie, you have to go. So you can buzz off whenever. And if you guys have questions for Morgan or Heather, you can post them in the bottom and we can come back to them. So how about, let's go to Jeanne next because she has a connection here since she was with Sophie, and she can talk, she can talk a little bit more about her program, which really spurred Sophie's placement with me, so.
Sure. So back when, like I said, when COVID hit, we were trying to figure out, I don't like that word. I don't like saying hit when it came upon us. We were just trying to figure out, primarily at that time for the students that were about to finish, how could we help them finish in a more timely manner? And then we could figure out, how to deal with Sophie's cohort once we got that group finished. And like I said, I somehow I got an email communication with another OTA fieldwork coordinator. I think can't remember where she's at. Her name is Kristen Courtney, but I can't remember where she's at. And she had started something for their students. And so I was kind of having an email conversation with her. And like I said, we were trying to use our community-based fieldwork. We have a community-based fieldwork with a senior center. So usually we take the students there, we go, we run programs, you know, do some individual sessions, do a lot of group activities, do a lot of wellness checks and things like that. And we couldn't do that when they were isolated from COVID. They were getting meals delivered. They couldn't go to the center. And we didn't know how many of them had access to Wi-Fi and had a computer or had a cell phone or those things. And so I was just brainstorming and it just hit me. My friend is a member of the Sisters of Loretto, or they call themselves the Loretto community. And I thought, I know they've been doing their meetings via Zoom for like the last year. I knew they had access to it and they're an elderly population. So I just thought it would be a really good fit. So I called her and I said, hey, do you think you guys would be willing? Well, here's the one caveat. They're almost all retired teachers. So they were really excited to be able to help students complete their education. So that was another bonus in our hat. And like I said, this came like in the middle of May and we started the Tuesday after Memorial Day. Like it just came together quick.
And you had how many students doing that?
We had 3 initially, and then we had 2 because one student had to back out for some issues that she's now in the process of finishing up as well. But
and they each had how many clients?
So they ended up with 7 to 8 students each. Originally it was going to be 5 to 6, and we got 15 participants. So we had 15. So one had 7 and one had 8.
And they met with them twice a week, right?
Twice a week. And then every other week, with some of them, they would do a group. So they did both individual and group.
Yeah. So, I mean, I love this idea, you guys. I mean, they took people in the community that are isolated, but yet are willing to participate and help students. And the students were able to meet with them individually twice a week, do a group with them. And that's where we took our idea for Sophie and Morgan to do their clients or work with their clients.
And it worked out really, and actually one of our students, one of her clients was from London, England. So we had clients from Colorado, from Kentucky, from Kansas City area, St. Louis area. I feel like there was one more and I can't think of it, but yeah, so it was pretty fun.
And you guys use Zoom too, right?
We use Zoom, and we're only limited to a 40-minute account. So it happened in 40 minutes. And then usually we would check back on with the students afterwards and kind of do a debriefing with it. So it turned out really, really well. And then the nice part is the program director is the OT. And so the students did the evaluations with her. Like she modeled the first one and then kind of let them take over as they went through their evaluations, because she ended up doing 15 evaluations in a week. So it was a little hectic.
Well, and then, so what I like about Zoom, and Morgan and Sophie can kind of talk about that initially, but that I didn't even think about. So we were on Zoom and I was able to private message like Sophie or Morgan, yeah. Like if I thought something was maybe struggling or if I wanted to share ideas, I could private message them ideas to kind of help them out. And I'm like, well, that's cool. I mean, even in real life sessions, you can't really do that without the clients hearing you, but through Zoom, you're able to share that.
That was a nice benefit of it. And we utilized it quite a bit in the beginning. And then as they got more confident and stronger, we could back off with those, or we could say, hey, that was really great. Or I really like how you did that. You could give them feedback right in the moment, which was really nice.
Yeah. And you guys were the supervisors. I mean, the instructors and program directors were supervisors. Yes. So OT programs out there, you could implement this model. And I know I'm going to hear from other people, I don't have time for this, but we scheduled it. So and they know this better than anything, that I often had other things that I was doing, but they were on so I could hear them and see them and they could chat. So I could kind of do a couple things at the same time. So it wasn't like it was all of these hours just for that. because once they got going, I mean, they didn't really need me there, but I was there for that supervision if they needed. So many things you guys can do. And I think Jeanne needs to replicate, or they need to get this program replicated in other schools. It's such a great idea.
And I will say, in the beginning, it was those evaluations, again, that first piece going, but once you get that done, it flowed pretty well. And then the second time we ran it later in the summer and into the fall, what we did, or the beginning of the fall, what we did was we utilized one of our adjunct instructors, because the program director was the instructor for the mental health course, and I was doing the instructor for our fieldwork part of it. So we actually were able to utilize one of our adjunct faculty to be the fieldwork educator the second time we ran it. And then I, again, was backup. She's an OT as well. So I was backup for her whenever she wasn't able to be available, I could be available. So that worked out as well. So
is Rachel the program director?
Yes.
Rachel, if you want, I'm going to pull you on. You don't have to join us if you don't want to, but I think it's pretty awesome what you did with all of the evaluations and so forth. So if you want to pop on and say hi and tell us a little bit, that would be awesome.
This is impromptu, isn't it?
Yeah, sorry. I like putting people on the spot. Thanks, Rachel.
Totally okay. I'm totally flexible like that. So what we did for our evaluation process, we used the COPM, the Canadian Occupational Performance Measure. It was really perfect for just doing that interviewing component. And as we kind of went through the process, we saw significant improvement in the students' use of interview. I feel like that assessment is really great to get them asking the right questions. And the more we did it, the better they got. And they would be like, well, what about this? And I'm like, oh, good question. Let's, like they jumped in and were a huge part of that process. Plus, it also helped us when we started talking about treatment planning. They were fully in the process, and they could then say, well, I noticed this, this, and this. And so we could build that into goal writing and into that treatment plan.
Awesome. Thank you. Does anyone have any questions for Jeanne or Rachel? Because again, love their program, love how they set that up. You guys need to do a presentation at AOTA and stuff on that too, and write an article. So that's one thing Sophie, Morgan, and myself are doing. We are putting an article together. So, okay, so we're running out of time, or we're going fast. So Erin, pop on. Erin and Sarah, we want you guys to talk because I know you guys have places to go with your little kiddos.
Sarah, do you want to kind of explain?
Sure. So I teach the program development course at Midwestern, and that's another area of passion of mine. And when COVID happened, we really didn't want to delay graduation for our level 3 OT. So we flip-flopped some courses. So none of our students have actually been impacted. Their graduation hasn't been impacted due to COVID. And I had 3 students who ended up not being able to be placed again. So we developed a program development course specifically online digital content creation. And Erin ended up doing the topic of occupational justice, and I'll let her talk about that. And she's had amazing opportunities come out of this. There have been schools that have wanted to implement her program. She's been asked to come on as an adjunct in the winter to teach an elective on occupational justice, which I think is pretty incredible and well-deserved. Erin's an amazing student, soon to be OTR. But we just really wanted to be as creative as possible, but also expand the boundaries of what we can do as OT, because I don't think that we do it enough. So not only did they have a guide and were provided with the education to be able to, sorry, one second. Dexter, come here, please. I have a dog who has a lot of anxiety. not only do they have the education on how to develop a program and implement it, but they also received a lot of education on different platforms to use. So Erin utilized Teachable for her program. I think she's going to continue using Teachable going forward, but it's also a really great way for them to be able to monetize after they graduate with this program. And that was kind of my goal for them, is the 3 students all had an area of passion that they really wanted to focus on. And I wanted to really help, bring that dream to life for them.
Yeah, so like Sarah was saying, I focused my level 2A on occupational justice. And I started out by doing that with a really kind of widespread community assessment of the area that I live in now, which I did not live in at the time. I went to school in Phoenix, and I now live in the Milwaukee area. So I was able to connect with 15 to 16 different professionals from a wide array of backgrounds. Some worked in public school districts. I interviewed 3 different OTs. Some worked with nonprofits. Again, just kind of a wide variety of people to really get an understanding of what essentially the juvenile justice system looks like from before an adolescent ever ends up in the system to what it looks like during the system, and then also their transition either back to school or kind of that post-secondary transition into working life. And through that, I was kind of able to recognize that there's this huge need for knowledge of occupational justice, not only within kind of like the general world and population, but more specifically within the OT profession. I then kind of zeroed in and did a smaller assessment that was just available to OTs, OTAs, and then students, and was able to kind of identify what the gaps in between knowledge and practice were. And really, people didn't understand. They understood occupational justice kind of as a concept, but they didn't recognize that as OTs and OTAs, you are actually practicing occupational justice just by the nature of our profession. So I ended up creating a 5-module course then that was free and available to anyone that signed up. And I had over 110 people sign up. And that included people from all around the world. I was able to connect with OTs in Israel, Germany, some in South America, which was really awesome. And in my course, I included global research because, again, it's just, it needs to be understood from a global perspective. So then, like Sarah said, I've now been asked to teach it as an elective at my university. There's a professor in Germany who is using the content to help with her, one of her courses that she's teaching. I had some students who reached out and asked if they could present it to their professors to try to incorporate it into their curriculum. So it's been really positive. And I think the best thing and most rewarding thing for me is that I've been able to continue the relationships that I built through those initial interviews. And I've continued to work with specifically 2 agencies. One is a school that is run at a juvenile justice center. I've stayed connected with the principals there. And then another is a youth advocacy nonprofit who takes in cohorts of high schoolers and kind of teaches them how to advocate for themselves along with teaching them life skills. So I've continued to work with them, and I'm hoping once I have a little more time and I'm done with fieldwork here, that I'll be able to implement some more education for them as well.
Wow, that's awesome. So you totally need to come in and do a presentation for our next level occupational therapy group on it. I mean, because there's a huge need for that. How was it? I mean, because I see more and more therapists trying to do like the online content, online course creation, and things like that. Can you tell us a little more specifically, like how did you learn that, or how did you develop those skills, and how did that go?
Sarah. So one of the last courses I took, and it was due to that switch. Typically we have courses over the summer in between our level 2s, but because of COVID, we ended up having our summer courses in the spring, and one of those is program development. So this kind of ended up being an extension of the big project I did for that course. But Sarah was really the biggest resource. And I've actually continued to expand and use Sarah as kind of a model and a guide. And I now have my course on Teachable on my own website rather than the student one that we had previously. And I have an Instagram account as well. So the course is now $10, but I'm offering kind of free tidbits on that Instagram account. And we'll be interviewing different students and professionals to kind of talk about how occupational justice isn't just this like concept, it's actually this thing that we're doing and working towards.
Wow, that's awesome. Can you share, because we have people asking, can you share your Facebook your Instagram account, your website, and all the resources on that? And then we'll also put together information of everyone on this panel tonight and send it out to everyone's, if you guys are willing, so if people want to contact you guys. So that's awesome. So how do you feel this level 2 placement is helping you with your future versus if, say, you were in a rehab center or a nursing home or something like that?
Yeah, so being in a school placement right now, which I absolutely love, and I can totally see myself doing, kind of doing a combination of these two things. I feel that I'm able to communicate with parents and teachers and other professionals who are not necessarily in like the rehab world, the value of OT, because I did that so much during my first, interviews, that I was explaining what is OT, what can I offer to you, why is it relevant to you, and now why is it relevant to your student. So that's been super, super valuable. And it's also, the school district that I'm with is very intercollaborative. So I've done co-treats with speech therapists. I work heavily with the special ed teachers as well. So I've been able to kind of collaborate with them more and figure out from a more global perspective, rather than just like an individual, like one-on-one student, what do they need? It's more globally like, okay, what does this grade need? Or what does, the school as a whole, like what holes might there be? So I'm able to look not just at individuals like you might do in like those one-to-one settings. And sometimes you do groups, obviously, but I'm able to take a bigger snapshot of everything going on and look at it from more of like a systems perspective.
Awesome. And like Sarah, Jeannie, Claire, Felicia, Alexis, what are your thoughts on, so they have 2 placements. Like, I personally think, one placement kind of in a more traditional setting and then another placement in this non-traditional setting is the way to go versus 2 very non-traditional placements. But I don't know if that's, everything's changing. We're becoming more virtual. We're becoming more non-traditional. So what are your guys' thoughts? Do you think 2 super non-traditional settings, because they also have to pass the board. So I'm just interested in all your thoughts on that.
So I definitely think they need to have at least 1 traditional. And actually we've had discussions where we're doing a little bit of a curriculum-ish change to make it feasible for everyone to have a little bit of a role emerging population-based health placement. And COVID kind of messed that up a little bit. But next year, we're going to tack on an actual implementation phase with the program development in the summer so that they actually have, they have to do that needs assessment with a group of people. And they're going to go out as groups and they have to find the gaps in the literature and do a full literature review. And then that's where they start to actually develop the program. And then they can meet the needs of more of a non-traditional population or role emerging placement. But I definitely think programs have to be pushing towards that way. The United States is one of the major countries where OT is extremely popular, where we don't do role emerging. The UK, Canada, and Australia have been doing role emerging for years. There's actually a book out there called Role Emerging Fieldwork Placements for OTs. And all of the authors are from other countries. And I just think we have to be forward thinking and really think about going forward. OTs just working in these traditional settings is not sustainable. And I think we even have to expand what is non-traditional. If you can justify OT's role, there's so much we can do beyond what we're already doing. One of the students that did this with Erin, her mom is a headhunter, and she was telling her mom, because I said that would be like a dream of mine, is to like figure out how OTs could be headhunters, because we've talked amongst our faculty about potentially doing a study on sensory profiles of people in different work industries and how it relates to job retention, satisfaction, quality of life. And think about how well OTs know how to figure out, you know, where people are best. It's not just the job, right? If you use the PEO model, it's also the environment they're in and their social needs are met. And her mom was like, oh my gosh, I should look at hiring an occupational therapist for my agency. That would be amazing. And I just think we need to start thinking this way, because the opportunities are endless. We have to stay true to what we do. We have to remain occupation based. But I think we really have to just expand the way that we're thinking.
I love that. And how cool. I've never thought about occupational therapy therapists or occupational therapy professionals and headhunters. I mean, but yeah, how you described it fits really well. So, okay, Jeannie, or
I was going to agree with Sarah in that I think some of it really starts with faculty. I think it depends on what is your faculty sort of, are they open enough to consider it? I really think that is a huge block for some programs. It's not for ours. We've kind of been, Rachel and I are just kind of those kind of people. So we do a lot of community-based field work for our level ones so that the students can be out there and be more hands-on and plan those interventions and be more involved with it than just sort of taking in all the information, but actually be engaged with it. So I think that's really important. I think it's interesting that just on the feedback recently from one of the cohorts with Sophie, that member had the virtual experience first and now just finished a traditional placement. And the fieldwork educator said, I just don't know if virtual experiences are what the students need. And I'm like, well, it's what's coming. Like, it's here and it's guided by OTs and OTAs. We know how to make it meaningful. So I think there's going to be a little education involved, especially for those OT practitioners who come from that rehab model. Those rehab model, and I was there for a little while myself, they can become very routine and very stringent and just that's OT. Anything else is not OT. So
I love it. Yeah, great points. Claire, did you have something to add on this?
Well, I think it's good to have a traditional and non-traditional combination. I think it does give you a good balance of the field work. So I don't know if you want me to talk about our experience now.
Well, do Sarah and Erin, do you guys have anything else to add? I mean, I think all the things you guys are doing is awesome. Anything else you would recommend before we go on? I know, Sarah, you have to get going, and Erin with.
No, I don't have anything else to add, I think. And I think maybe the last point I want to make about role emerging and unique placements, it's not for every student. It has to be a very special student, a go-getter, independent learner. And we're developing, we have now like a handbook in an application process for students who want to do role emerging. I mean, because Erin was as you guys can tell, she is like 1 in a million kind of student. And it has to be a student who is a self-starter.
That is such a huge point, because I actually had a minor panic attack like a few days before fieldwork started, because I mean, Morgan, I knew, I pretty much self-selected her, so I knew she would be a perfect fit. But, I signed up for a student and I didn't really know Sophie. And then all of a sudden I had a panic attack and I'm like, what if this doesn't gonna fit? And I told her, she was absolutely the perfect fit. So now all students have to have all of her characteristics going forward. But I'm like, I just know there are a good chunk of students that wouldn't have succeeded doing that type of placement that she did, especially with adding on my chaotic life on top of it. But you're so right. That is a huge proponent. I love that you're having the application process and so forth. And I thought that myself too, that I want to develop a at least do some, an interview or talk to people before, but I also just kind of trusted that Jeannie knew that it would be a fit with what we were doing. So, but I love that. Good point.
I think for me, going back, Morgan and Sophie kind of touched on this, but like Sarah said, there was 2 other students besides me who were doing similar things at the same time. And we did like weekly and bi-weekly check-ins with each other, and having them as support, even though we were all doing slightly different things, was really helpful, I think. Just because there are times like when you're doing this that we were kind of like, do you feel a little lost, or like you don't know what you're doing, but it's still going well? So it's nice to just have those people to bounce ideas off of, but also just to reassure that it's okay if we don't know exactly in that moment, that things will work themselves out. And again, just to have those people to bounce the ideas off of and be like, okay, I'm really stuck with this. What do you think? Do you have ideas? And Sarah kind of mentioned this to us too, that when you have your own practice, that you kind of do that too. You have your people that are your go-tos. So I think having a support system, or, making sure that they're connected with other students who may be doing similar things, is really important.
Yeah, I think Morgan would definitely agree with that. We should be putting all of this stuff down or adding that into your list of, if you are doing this type of placements, having a support system for the students, having the interview, having kind of the list of people that would work in that. I mean, that's a great point, you guys. Okay, awesome. Well, thank you guys so much. And everyone check out, they posted their websites, Facebook groups, and check out the Innovative OT podcast as well. So Claire, you're on.
All right. So talking about that whole rehab model, that's the kind of the model that I came from. And so whenever I was approached by St. Kate's to do this kind of role emerging field work, to be the fieldwork educator, it took me a while to get my head around, like, how is this going to work? And so what it is, so we, one of the facilities that we did our level 1 fieldworks with, and I've been there with several level 1 students in the past. And so what they did was they approached them, and so basically I was the fieldwork educator, or the CI for Samantha, but I was not at the facility. There was an on-site supervisor at the facility who agreed to take her as to be her supervisor there. She's not, they don't have OT at this facility. And so it's a daycare for adults with intellectual disabilities. So it took me a while to get my head around it. We didn't have any kind of, no handbook to go by, no protocol to go by. They have no charts there on the clients. I mean, it was all just kind of let's just go in and try to figure this out. So Samantha had, 4 weeks left on her field work. And so she's in California. I'm in Houston. The facility is also in Houston, but I didn't go there. So everything was done virtually. And so I totally agree with making sure you have the right kind of student with this. Samantha was awesome. She took initiative. You have to be somebody that takes initiative to with communication. She had to make sure she communicated with the supervisor, the on-site supervisor, and communicated with me. And she had to be totally prepared to provide the on-site supervisor with anything that she needed, any supplies, any worksheets, anything like that. So she totally had to make sure that she was communicating with the on-site supervisor, and then checking in with me. And then, so I would get on, so we did most of it through Zoom. She and I would meet through Google Meet. So the facility also had clients that went in person, but then they also had clients that were on Zoom that would check in from home. So I'll let Samantha talk about a lot of the stuff that she did.
Hi. I don't really know where to start, But yeah, so I just had 4 weeks left, and I'm living at home with my father right now, who's high risk. So I actually kind of asked St. Kate's if I could do telehealth, or I said that I would prefer to do telehealth. So I was ready to do something completely new and different, and I'm really glad that I did. I think personally, I think it was a great experience for me to do in person, and then also be doing this non-traditional telehealth experience, because I think that it opened up like my possibilities for what I might go into once I pass that NBCOT, because I have experience now in different areas. Personally, I think that doing the in-person and a traditional setting first was beneficial for me. Personally, I think I could have done it, but I think that, going back to the question of whether, someone should have like two settings that are like non-traditional or whatnot, I think that it really helped to start with something that was traditional. And luckily, pre-COVID, I was able to do that. So I think it was helpful starting with that. And then otherwise, yeah, it was meeting with Claire and meeting with the facility director via email, via the Zoom sessions, and having a lot of communication between us on what our plans were was really helpful. I started off the first week just kind of sitting on Zoom, either for their sessions via Zoom or their in-person activities with the clients there. That was a little bit overwhelming because I'm just over here on my iPad screen, and I can talk to people, but there's only so much I can get when it's like a full room of people. So that was challenging, but once I started getting to know some of the clients and they introduced me to certain clients and talked to me about them, then I started doing interviews with them, and I ended up having 3 clients that I worked with via Zoom, and sometimes Claire would be there, sometimes she wasn't, but the fieldwork, the facility director was always like in the room with the client or just like a room over. So that was really helpful. And then afterwards, we would all sit on Zoom and talk about the session, me and Claire and the facility director. So that was really helpful. Yeah, I guess, do you guys have any like specific questions?
How do you feel? How did you feel not having an OT on site? Because I've actually set up students with fieldwork placements kind of similar to yours, that they didn't have an OT on site, but they had other situations, and some students don't like it because they're like, I need an OT there, but some students like it. What was your thoughts with that?
It was fine for me, but I knew that people at the facility had some exposure to OT, having like had Claire at the facility before and had other students from St. Kate's there before. So it worked for me, especially since, one of the clients, they came to me and said, you know what, this client has trouble with so-and-so. Like, is that something you can help with? And that was a great thing to help with for OT. So then I was able to work with them on working with the client with that stuff. And they were great in facilitating conversations with the families, or with some of them lived in group homes. So some of the people at their group homes in continuing treatment after the fact. So because I feel like the facility was open to continuing treatment, even though they don't have OT, in the ways that they could continue treatment, I thought it was great.
Yeah, I think even though they don't have OT there, I think a lot of their clients could they could totally use OT there. And so I don't think it's something that they're ever gonna necessarily hire an OT to be there, or maybe, but I mean, they could totally consult with an OT. But yeah, a lot of these clients, like some of the clients that she worked with, it was a lot of executive functioning things that she did. Some just kind of ADLs, like folding laundry and things like that. And so it was, and just basic, just more occupation, like instead of like the one client that she was talking about that didn't move a whole lot. It was just like, let's get her doing some kind of occupation. So Samantha and the facility director came up with a job for her to do, where instead of only her getting up when she gets to the facility, when she goes to the bathroom, and then when she's going home, those were the only times she was getting up during the day. And so they came up with a plan that, she would, before lunch, she would take the lunch attendance, or, she would get up, she'd have to go bring it to the front desk. And so, and then there were other activities that other, just tasks that they were going to kind of incorporate for her to be able to get up more during the day, where she just wasn't sitting at a table all day. So it was just things like that, I think Samantha gave them some really great idea. And so like a couple of the other kind of higher functioning ones, like I said, with the executive function, they were doing meal prep, they were doing meal planning, they were learning how to order online, order the groceries online, and, do different tasks like that, where it was extremely beneficial, and the clients loved it. They loved, getting a little bit of independence. I think they really liked it. They liked the connection with Samantha. So, yeah.
And I think these type of placements are great, because we need more places like this to know what OT is all about and what we do. And obviously, they had some OT in there, but that's why I think the value of getting students into these types of places, because there's so many places that OT would add so much value to. So I love that. I love the setup, and yeah, being able to utilize Zoom and so forth is great. So awesome. Does anyone have any questions for Samantha or Claire, or do you guys have anything else to recommend to people looking at this type of placement? Or okay, awesome. Well, thank you. And last but not least, Felicia and Alexis.
So our program is quite large. So we've been actually doing role emerging and community-based for 7 years, I believe. So I've been on staff for 6 years and running the pediatric wing of it. But what it looks like today was not what it looked like a year ago. We are primarily right now in daycare settings and preschool settings. We had to do a complete change of what we were doing when COVID started, because the preschools that we were at, they closed down, the daycares closed down. So we had to really think about what we could do with the students. At the time, I had 6 students that needed to finish their fieldwork, and we were able to give them a few things to work on for program development initially, and to get started with merging us into more of a telehealth practice with our children that we were already servicing at the daycare settings. So we did that throughout the summer. We went back to one of our preschools who had a summer session. So we had some students that were doing telehealth and some students that were on site. And then I had 2 students that were working on business plans. They were using Kara's template, and they were working on business plans on how we could expand our program, because you know, in the foreseeable future is that it's likely that our daycare settings will close down again. So what could we do with our program, because we need our community-based program to continue. So we are revving up. We just got approval to expand and provide services to the university's staff and faculty children. So we're going to continue and offer services that way remotely for all of our programs. So kind of, we do have, right now I have 4 students. In January, I'll start back up with 6 again. So I'm located in Wilbraham, Mass. And I'm licensed in Massachusetts and Connecticut. So we provide services in both states. Lexi, you want to talk?
So I am actually in the community-based mental health settings. So I was actually a student at this particular practice setting. So it was my second field work, and I ended up coming back to work for them, which I was really happy about. I actually, you know, one thing that I can say just being a student is I took my first job where I was the independent OT, and, you know, some will say that's not a great thing and others will say go for it. But I think that to having an emerging practice field work and of being able to do that. So we have several sites. We are involved with local senior centers, clubhouses, just different sites. With some of them are young adults and then older adults. Another site is a congregate housing facility. And so that is really connected with the housing authority that's local in our area. So we're able to be on site with those folks and then doing some telehealth services. So a little bit of both, so the students get the best of both worlds. But it was very challenging doing telehealth because I had no experience with that. So I was learning with the students, and it was hard to answer their questions of, you know, well, what should I do, or what are the resources, just because we were learning together. So yeah, they've been doing recorded videos as well, and just sending them out to the facilities so they could post them on their Facebook page. And one thing that my students have actually just started working on are recorded videos and putting them on DVDs. Because a lot of the folks have, you know, DVD players, or the facility maybe wants to play it when we're not there. So similar to what was being talked about before, our sites do not have an OT, you know, on site. They have an on-site supervisor that they go to, who might be a case manager or a different professional. So
oh, and sorry, Lexi. One thing that Lexi is part-time and she has full-time students. So I know that was a question that had come up before that. So she is part-time, and so that is possible. It depends on the licensure laws in each of the states, because every state is different. But in Connecticut, she's able to do that.
Awesome. My internet kicked me out for a while, so I missed part of it. So Sandra has a question. Without a direct supervisor, any difficulty with ACOT? So with a non-traditional setting, you only need 8 hours of OT supervision, and there's so many different ways you can do that. So Felicia, do you want to talk about that, or Claire? Or anyone?
So so we've done it a variety of different ways. Right now I'm almost, I would say 95% virtual. So my students are on site and I'm off site. So they go on Zoom and Google Meets, and we do supervision that way, where I watch what they're doing for their treatment, and then after we kind of talk about how they did with that treatment, recommendations and things like that. And then we also have meetings. One of the things that, because we have such a large cohort of students, that has been difficult is finding space for all the students to be in one spot to have meetings and things like that, which we never even considered doing a Zoom call or a Google Meet call before now. And it's so much easier now to meet with all the students at once. So it's been actually, helpful for our practices for this.
Well, yeah, I mean, that's kind of, and when, sorry. I don't know what they're doing. Good gravy. So you can technically supervise really then multiple students, but do that 8 hours for multiple students at one time. So
right. So you can have supervision of 2 students at the same time, and it still counts as within their 8 hours.
Yeah, never really thought about that, because yeah, now when Felicia told me how many students she has, I'm like, oh my gosh, how do you do it? That's awesome. But no, that makes good sense, and really programs need to think about that, because you could create a position. I mean, I know funding is always an issue and so forth, but really you could have one person responsible for 8 hours of supervision a week, and they could have, 10 students at one time through that. So, never thought about that. Great question.
Well,
Great
what
idea.
Rachel and I did before, when we had our community-based program, we would make Friday sort of be our administrative day. So that was the day that we made sure we were always meeting with the students, and that would get a couple hours, and it would give them planning time, so that they wouldn't always necessarily pack the day on Friday with treatments. They might do a group or something, but then we'd leave the afternoon open, and that would be our planning time, our meeting time. And you could get 4 hours in with whoever you had decided at one time and make it really work well. So
that's actually what I do.
Yeah.
And it's worked out really well. And they actually, some will meet as a group too. And they like being able to hear, what the other students are doing.
Yeah, that's great. Yeah. I love your guys' practice. Do you do a collaborative of OT and OTS at the same time?
So right now the university only does the OTs. Okay. I've in the past, because I've worked for another college that had OTAs as well. It's been, talked about, hopefully we can at a certain point be able to collaborate with 2 schools that we could then connect the OTs and the OTAs. We do have several CODAs on staff in the Fieldwork office who do sometimes come out and help us with hours. So we have the students supervising those CODAs that come out, so that they can be able to have that interaction with the CODA as well.
Great.
And then I'm thinking here, but we can also bring students into the mix. So I think of like with Heather coming in, like she helped provide some of those hours, supervision hours, to the OTA students. So again, getting creative and getting those 8 hours in a week really isn't that much. And how can we create these OTA collaborative sites and use OT students to help supervise OTA students, but yet also have the OTs, there's lots of possibilities out there. Awesome.
I really enjoyed having that opportunity, by the way. I just have to say, being a CODA, I've taught other student CODAs, but I've never had that experience as an OTR to have that CODA supervision. And so I took it to a different perspective, and it was just really nice to have that opportunity. And so I'm grateful for that.
On top of that is, I think it was so awesome because, you're an OTA and they're both OTA students. So for them to, since I'm an OT and not an OTA, for them to have you there as an OTA plus the OT student, I think was an awesome mix as well. So, because sometimes I hear that, I don't know if you, Jeannie, or hear this, that OTA students, when they have OT supervisors, they sometimes would like to have OTAs as their supervisors and so forth. So I liked that mix in there too.
Yeah.
Can I ask Lexi a question?
Yeah, sure.
Okay, so are you physically there in the facilities with the students, and are the students physically in the facilities also? Oh, you're silenced.
So there was a time period in the summer where two of my students, they were full telehealth for 6 weeks until I could get back on site, which is where our main office is, in the congregate housing facility. And once we were able to get back on site, my students have been doing their telehealth sessions there. And then I come in and out. So I've been doing a combination of both supervision through telehealth, like they're actually going to start putting me on Zoom. So I can see their groups, but I'm also there on site, but not for the full 8 hours, 5 days a week.
Right. So we were trying to get more than one student to come to the facility that I'm at, or that I had Samantha, and I have another student starting on Monday, and they were wanting to do multiple students, but the on-site supervisor there, the facility director, didn't feel like she walks around with her laptop or her iPad to go to, whatever clients. So I guess she didn't feel like she could coordinate more than, do your students stick together, or they see different clients, or are they working with groups? Just
they do both. So they co-lead groups together. They run a few groups throughout the week, but then they each have their own individual caseloads. So they see a couple telehealth clients each, and then a couple on-site clients each as well. So I just kind of balance my time of, at the beginning, I'm there much more and on their Zoom telehealth calls. And then checking in on site, and sort of as I gain more independence, I might not go see that on-site treatment, but I'm going to go pop in on the Zoom call. And if I'm on site, it's much easier for me to go pop in on the treatment and then jump on the Zoom call and kind of go back and forth.
So is there somebody at the facility that gets the clients, on the calls or whatever?
There's an on-site supervisor, but really they're just there for, if something happens, like an emergency, or to gain more information about the clients. And so the students are responsible for putting the client on the iPad. So we're just starting that now. So the on-site supervisor really doesn't have any involvement with that. They're dealing more with issues in the facility.
Okay. So the students are at the facility physically? Yes?
Yep.
Okay. All right. Well, that's a little bit different.
I personally think having more than one student, like at a site like you're talking about, would be really beneficial. I mean, I don't, Samantha, you can give per your perspective, but what do you think about having another student there or a couple? Because then you guys can plan things together and have that additional support. Or
for this circumstance, I was fine being on my own. But in my first fieldwork experience, I was there with another OTA student and an OT student, and I loved being able to work together with them. I think that via telehealth, it can make it a little bit more complicated, just because you have to, text okay, are you coming on? This is when we're starting. Make sure everyone's on the email chain. But once you get all those things worked out, I think, obviously having more people is always beneficial. But at the same time, I think it worked really well the way it was. So I don't really know. I'm kind of going back and forth with that one.
I had some students that shared one client over telehealth, and what they did was on one day, one of the students would just not have their screen, they would stop their video and they were observing the other student, and on the other day they would switch. So they it allowed them to see the other student treating and gain more ideas for themselves, and that helped their growth as well. I think that the students definitely benefit from the collaborative approach and having another student there, but it's also important that you set up some individual sessions for them as well, because there are some students that rely on their partner a lot. So, pushing them outside of their comfort zone so that they can develop those independent skills as well.
With Morgan and Heather and Sophie, they actually attended each other's sessions so that they could see, how each other did the treatments, and then also if they had questions, or they could be there to support each other. So, Morgan had her 2 online clients that she met with every week, but she also attended Sophie's online clients at the same time. And then when Heather joined, she attended as well. And I think it worked well, and the clients were fine with multiple people on, and yeah.
I guess I just need to get the on-site.
Joint.
Yeah, I guess I need to get the on-site supervisor more comfortable with that. Because she's, I would be totally fine with it, but she's just like, I don't know how I could, coordinate, for her to coordinate 2 at the same time. But I guess if you can just, do they, so they treat some, or they observe, they have different clients that they treat, but then they observe the other one while they're treating. Is that what you're saying? Okay.
Yep.
Okay.
Yep. Yeah, there's so many possibilities out there. Yes, Rachel, I like that. I think Rachel said in the chat, I think collaborative really helps students learn how to give each other feedback, which is so helpful once they are out of school. And just having those more students is also helpful for OT and OTA practitioners that are really busy, because say if Morgan, she could get help from Sophie. They helped each other a lot. Heather helped them a lot versus just solely relying on me. So you get more people providing you ideas and input and so forth. So, well, I know it's really late. We've been on a long time. All of you guys are amazing. Lisa had to go, so I'm super, super sad you guys missed hearing more about her nature-based practice. So we can always bring her on again, but I'll make sure all of her information and resources are on we'll put together an information sheet with everything that everyone talked about tonight. So you guys can reach out to people if you're interested or need more information. So we'll put that together. This is recorded, so you can watch it on replay. Anybody else have any other things you want to add or input you want to share? Or anybody that's attending, do you guys have any questions? Because again, we want to try to help all of these students that are sitting there at a standstill try to get a placement so they can graduate. And there's so many opportunities. Like Heather, how long were you waiting?
It will be a year that it's taken me from the beginning of my first level 2 field work to by the time we are finished. So it really should be a 6-month situation. But the last several weeks of my level 2 fieldwork, my first one was at United Cerebral Palsy, and they shut it down. I was there until mid-March. And so the rest of it I had to do we did a little bit of telehealth, and we also did special projects. So I was very grateful to be able to finish that one. And then, you know, March rolled around and finished that one, but to find another placement took a long time until Kara was able to give me the placement with her. So it's been a long road, and I am not the only one that has had that happen to them.
And that's just it. If everyone that's listening, either now or recording, I mean, this is a problem. I mean, these students that can't finish their placements, then, I mean, it's impacting their lives in a major way. I mean, you think about how long it pushes everything out for them to get a test. And then, and I've heard, I mean, I think there's some help in the works. I'm not familiar with everything, but doesn't sometimes their loans get affected, Jeannie? And you guys might know if they're not doing any credits or anything, then I've heard some might have to start paying back their loans and they're not even done, but I think there's some federal help with that. But I just can't stress enough that we got to be thinking together, and therapists, seriously consider taking a student. There's so many options, and they can help you with your practice and anything that you want to do. I mean, like Erin, with creating an online program and so forth, therapists could take students and create online programs for, I mean, there's so many options. I just can't, we need to work together and help these students. So Rachel said, I think they have 3 months before loans are due if not taking classes. Yeah, I mean, it can lead to financial hardships. And I worry about some students not even finishing school if this gets on. So, I mean, I seriously think it's a major problem that we all need to step up and do some of these. Like, I think of Felicia taking all of these students. Like, how awesome is that? Every OT practitioner needs to take a student right now. So Shannon, you posted, if you want to post in the next level OT group, we've had some students post in there that they were looking for placements, and we've actually had therapists take them up on that. We've had a couple that were lost on placements, and other therapists were willing to take them up. You can also talk to have your school reach out to me as well for different options. So I just think we all need to work together and help as many people as possible, because I will tell you, and my husband will tell you, the last thing on earth I needed to add to my life was taking students, but they helped. I mean, they did so much for me that we each need to do this for our profession. So my little rant here. Okay, anyone else want any last words of wisdom?
Well, I appreciate you having this forum, Kara, and I think it's just a wonderful thing. So hopefully many more students will get their fieldwork placements and be able to move on and become OTAs and OTRs. So I just think it's wonderful that you had this platform today. So
yeah, and hopefully we can do it again, because there's a lot of people that are doing different things, and the more we can share these ideas, the better. So if all of you guys can share this video with people you know, or share it with your colleges or anyone, maybe it'll spark some new ideas with people. So awesome. Well, you guys have a great night. Thanks for holding on. I know it was a long night. We're almost at 2 hours. So appreciate if you're watching. Well, it's too late. I was going to say, one trick I've learned is to watch these webinars after they're live, and then you can like 1.5 times the speed, and you can go through it a little bit faster. So, okay, have a great night. Thank you, panelists. I so much appreciate you guys helping spread the word about different options out there. Talk to you all later.
All right. Bye-bye.